Today we're going to be talking about urgent care. In fact, in particular, we're going to be talking about urgent care in the Washington, D.C. area. And we have with us today Christopher Timm from Metro Immediate Urgent Care to talk to us about that. Christopher, thank you and welcome for joining us here on Plenary TV.
Oh, thank you for having me.
Great. Hey, Christopher, I want to ask you, as an expert in urgent care, what advice would you give to someone who is looking to get urgent care, who for themselves or for their family?
Well, I mean, I think when you're thinking about obtaining or looking for urgent care, the key points is that you're looking for accessibility. Being in the metropolitan area, there's a lot of mass transit services that we offer, and so our offices are normally located about a block and a half from a metro station. The second thing you want to look at is that you're thinking about how those hours of operations are, and so you need the care when you need it, and so being able to decipher that. The third thing is really to know that your physicians are board certified and have been practicing in urgent care for quite a bit of time. Also, making sure that the doctors have been in practice, whether it be in urgent care or in their specialty, for at least 10 years or better. And then the third thing, which is probably one of the more important things, is to be able to get a clear understanding of how patients are experiencing their visit at any urgent care center. Looking at the reviews and being able to understand what's on Google, what's on Yelp, and these things are really the definers of trying to choose a center that's best for you.
Fantastic. Well, let me ask you a follow-up then. So what might the patient expect to experience if they come into a Metro Immediate and primary care facility?
Well, at our facilities, we use we're very technology-based. We use an electronic medical record along with the practice management solution. We're 100% paperless. And so we're utilizing technology to create a better patient experience. When you do come into our offices, the sights and sounds and the way that the clinics are set up is to make you feel as though you're in a very comfortable environment. We have televisions in every room, computers in every room, free Wi-Fi, water, whatever you need to do to try to make your experience better. Our doctors and our patients, we try to bring them to an equal playing field. Instead of the doctor being at the top of the chain, we bring the patient and the patient and the physician together. It creates that symbiotic relationship, and we want to have you engage with your provider and engage in your healthcare, and that's, I think, what makes us different. In addition, at Metro, we offer a 72-hour policy. If you're not better within 72 hours, come back and see us. We'll cover the visit, and you can keep coming back and seeing us until you get better, or we'll find someone else that can get you better. Our goal is, at the end of the day, is you came in for a service. You're here to get well, and we're trying to get you well as fast as possible. We don't always get it right each time, but we're trying to make it right.
That's fantastic. I actually have never heard of anybody doing that before. That's terrific. All right. Well, again, thank you for those watching on Plenary TV. Thank you again to Christopher Timm from Metro Immediate Primary Care. Metro Immediate Primary Care is great in Washington. They've got multiple facilities, Capitol Hill, Cleveland Park, Silver Spring. You want to check them out, you can find them on the web at metroimmediatecare.com, and or you can just walk in. You can simply walk in because they do take walk-in patients. Thanks again. Appreciate your time, Christopher, and thank you for watching.